Hey, it's Dr. Phil Page with another research review. You know, rotator cuff tears are quite common in the rehabilitation clinic. Sometimes we see patients that have partial tears or small tears that we can rehabilitate and give them exercises. But some tears are full thickness tears where the actual tear goes through the entire rotator cuff. In a lot of those cases, it requires surgery in order to fix that problem. But there are some studies that have been shown that have shown the benefit of therapeutic exercise in patients who have full thickness tears. So that's good news because it means sometimes surgery may not be a good option for patients with full thickness tears. Some patients may not want to have surgery. And in general, we should try exercise before we use surgery as a last resort with these full thickness tears. Well, researchers in Germany wanted to see if the exercise program performed in a formal therapy setting versus a home-based exercise program would be beneficial for patients with full thickness tears. So the researchers took 38 patients who had full thickness tears and randomly assigned them to one of two groups. So the traditional control group, these patients went to formal therapy 3 times a week for 8 weeks where they were seen by a therapist and did their exercises. And in the experimental or the home exercise group, these individuals were given a booklet which included exercises they performed at home for a period of 8 weeks for about 30 minutes a day, twice a day. Now, at the end of the 8-week intervention, the researchers evaluated both groups. What they found was that overall, about 2/3 of all of the subjects in both groups improved in their clinical signs of impingement, which means that their pain decreased during the impingement sign test. And both groups also significantly improved in their range of motion and strength, which is a great outcome for someone who has a rotator cuff tear. The researchers didn't find a significant difference between the two groups. They both improved about the same levels. But what was interesting was that the experimental or the home exercise group had one more benefit. They actually improved in their health-related quality of life. So the researchers were kind of interested or surprised to see that there was this psychological benefit to actually being in charge of their rehabilitation, to have control, to be a more active participant in their therapy compared to the group that went to therapy 3 times a week for 8 weeks. And probably saw it as more of a passive approach to the rehabilitation, whereas the group that was actively engaged in their own rehabilitation, they were responsible, they did better in their health-related quality of life. So the researchers concluded that using an exercise program that included elastic resistance exercises, the things that we're able to prescribe for home exercise programs, can be a beneficial alternative to traditional therapy. And in addition, the patients are seeing those psychological or self-efficacy improvements in their quality of life, which may also translate into improved healthcare costs. So this has been Dr. Phil Page with another research review. I hope you have a great day.